Hi, I'm Gwendolyn Sterk of Sterk Family Law, and today we're going to talk about what do you do when you're about to go on Medicare. And I'm privileged to have Anna Minkina, who's an insurance consultant, to go through these various options. So thanks, Anna, for being with us today.
Thanks for having me.
Now, you're turning 65, and you have to deal with the inevitable, right?
It's a good thing.
It's a good thing. So tell us the period of time in which you should be concerned when you can go on Medicare and when you have to get off.
So you have 3 months before the month of your birthday, the month of your birthday, and 3 months after.
Okay, so you start getting all this paperwork in the mail. You don't know what to do. So our first advice, if you've seen the other podcast on scams, is talk to an insurance consultant such as yourself, correct?
Correct.
Now, people need to understand what Medicare is, and I think that the first thing is I think people get outraged because, guess what? They got to pay for Medicare, right?
That's correct.
Tell us about that.
You have to pay for your Part B, and depending on your income levels. Right now, the median is $135.50 a month for your Part B. So you have to pay for that.
That's the median. But if you're making more money than that, there's 4 additional layers, right?
Correct.
That you could have to pay.
Correct.
And so you may end up paying the government $300+ a month for
Correct.
your Medicare insurance plan if your income is high, correct?
Correct.
And you also might be paying more money for the Part D plan as well.
Based on
correct?
your income.
Based
Correct.
upon income. So that's number one. Number two is I want to talk about those individuals who now their earliest retirement age for full Social Security is 66+.
Correct.
Guess what? They're going to pay for Medicare. So if they're forced to go on Medicare at 65, but they're not collecting Social Security until they reach full retirement age, or maybe they even wait till age 70, they're writing a check to the government, right?
Well, it depends on if they're on a group plan. If they're on an employer group plan, they can remain on the employer group plan until they retire, and then not get their Part B.
Now, there are a lot of employers who try to say, no, I'm not going to cover you once you reach the age of 65. They can no longer do that. Is that correct?
They can't do that, but it's a great option for them to be on the Medicare supplements.
Okay. And if an employee, however, elects not to be on the group plan, that would be an option available, correct?
Correct.
As long as the employer makes the eligibility for the plan coverage, an employee might want to go on Medicare because it might be better coverage, correct? So, but then the kick-in would be you could be paying for it.
Right.
So you're still working. You
Okay.
decide that you're not going to be on your company plan.
Correct.
Or you're not working and you decide you're not going to take Social Security till you reach the age of full retirement, which could be 66, 67.
Correct.
As we all age out, that age is getting higher.
It's getting much higher.
You got to pay the government, right?
Correct.
That's a scary thought because I have to tell you that that's the number one thing that people don't realize is because now Social Security eligibility for full has moved beyond 65,
Correct.
but Medicare eligibility has remained at 65, that concept is difficult for people to grasp.
It really is, because they thought it was free.
They thought it was free, and it's not free.
Right.
That's number one. So you might be paying into the government to doing it. Now, if you do collect Social Security, they'll deduct the cost of the Medicare from your Social Security and give you the net amount, correct?
Correct.
So that's one option to do it. So that's the first thing you need to know about having the Social Security and that you have to pay part of the premium.
Correct.
Now, Social Security only pays a certain percentage of the overall cost, correct?
Correct.
And what is that on average?
So Part A and Part B together pay 80% of the cost. So you have the hospital and the doctor, so that leaves you 20% of the cost.
But you also have a deductible.
You have for Part B, you have $185 a year deductible.
Right, so you got the monthly premium to Medicare,
Right.
or that's going to be taken out of your Social Security. You either have to pay for it or it's going to be taken out. Then you got the deductible.
Correct.
And then you only have 80% coverage.
Correct.
So that's step one, guys, because that's really the problem. You're paying out of pocket or you're paying for that part.
Correct.
But that's not great because then if you end up, for example, you run out of your eligible days in the hospital, you're not going to have coverage past that either.
Correct.
So while it says 80%, there's only so many days a year under Medicare that you can be in the hospital.
Correct.
So when you run out of those numbers of days, you better have a supplemental plan or you're in trouble.
Absolutely right.
And so that's the scary part. So when you're dealing with that going forward, you then have to deal with the Medicare options. Can you tell us what the supplement and the Medigap plans look like?
So supplement options, there are a number of different options that include the deductible for Part B. And so you would have A and B, and then the supplement covers that $185. But in 2020, that option is going to be not available anymore. And you also have the Medigap plans.
Okay, what was that option called where they played the deductible? That was F?
That's Plan F.
And that's not going to be eligible unless you were on it before 2020.
or you were eligible for it before January 1st, 2020.
Got it. And then tell us what Medigap is.
Medigap are called Medicare Advantage plans.
Okay.
And they're similar to the Medicare supplements, only they're more based by private insurance companies. They take care of A and B and then the added benefits with it, but they are more network-based. So
explain that.
Network-based would be their PPOs and HMOs, depending on what company you're working with, but you have to stay within the network.
Now, what about your prescription coverage within the Medigap program?
So Medigap programs include prescription drug coverage, whereas supplemental plans, you have to have a Part D as well.
Okay, but if you're in a Medigap plan and your medication changes, so for example, you might get an autoimmune disease and now you're on a biologic medicine, which is going to be extremely costly and generally not covered unless you get a higher range, correct? Part D plan.
Part D.
So those costs for Part D can vary significantly, correct?
They can, yes, depending on the insurance company that offers that, absolutely.
So if you're going to go on a Medigap plan or you're on a Medigap plan and then your medication changes, is that going to be a huge cost difference for you to change?
You can only change those plans once a year, and your drug plans. That's October 15th through to December 7th.
Okay.
Then you have the option. And I always tell people to review their plans every year anyway, because like you said, they might have some instance where during the year they weren't taking any medication, but all of a sudden they had some kind of autoimmune or cancer or some other disease that came about. Mm-hmm. So review your plan once a year, your Medicare Advantage plan and your drug plan.
Now, if you're on Medigap and you have to change and go to a much different Part D prescription plan, for example, and I understand that it's combined, do you go to underwriting at that point in time?
So you can change in October 15th till December 7th. You have the option too to change from a Medicare Advantage plan and then go to original Medicare, which is the A, B, supplement, and Part D. So you can do that, but you do have some underwriting guidelines on that.
And so if you're taking a prescription that's costing $45,000, $50,000 a year, that's going to be a significant issue, and it may not be covered either.
It may not be covered. It may not be covered in any of the plans too, so they have to remember that.
And that's another issue, right?
Right.
And then I think it's part of your planning as well. If you've had a disease that you've carried, and since 55 you've been taking, it's been covered by your insurance, now you're going to go on Medicare, you might have to be working with your doctor about phasing off that medication because it may not be covered under any Part D.
Correct.
And so that's kind of an interesting concept as well. So that's the Medigap portion. Then outside of Medigap, or let's go back to Medigap. Medigap would be regional based, right?
It pretty much is regional based. They have instances where you can contact them if you're a snowbird and you say, is there providers in the area in Florida that would accept this plan? Okay. But it's a network-based plan.
And so by network, it would mean within the general area in which you live.
Correct.
And that Medigap is a little cheaper than a supplement as a general rule of thumb.
It is.
Now, can you explain what a supplement plan is?
Supplement plan is any doctor that accepts Medicare accepts the Medicare supplement.
Okay. And a supplement plan is the same, you're saying. The coverage is going to be the same. It's just a cost difference.
Right. With supplement plans, all the insurance companies have to report back to Medicare. So the benefits are the same because they're regulated by Medicare.
Okay.
The only difference is cost.
And then if you have a supplement plan, then your prescriptions aren't covered. So you're going to have the supplement rate, correct, and then you're going to have the Part D rate.
Correct.
And then on the Part D, you could take a lower level prescription and take the risk, or you could end up with a higher one, correct?
So you with Part D plans is by company too, and we do a list of medications, correct, and we'll see which insurance company, as far as Part D plans, have the best cost for that medication on that one. And then again, like you said, in October 15th till December 7th, they can look at it again to see, okay, maybe we want to go with a different plan because the costs are going up.
Now, let's say that somebody doesn't have the money to either have Medigap or the supplemental plan. You know, they're on a fixed income, they only have the Social Security. Social Security is already deducting that Medicare premium, right?
Sure.
What options are available?
They can do Medicaid. They can look at options for Medicaid, and there's also programs called Extra Help as well. They can help them with the prescription drugs.
Okay, and then that would be the extent of the options. So if you're going to go on Medicare, then you're going to do Medigap, supplement, or aid, correct?
Or aid, and then they have another one that's dual eligible disability. So they have two major instances. They have heart and cancer, or two different disabilities in that.
Okay.
And so they can get extra help as that way.
So that's something unique on the individual.
Correct.
Based. And then could you use a concierge plan?
You could use a concierge, but I would not do concierge without insurance, without a supplemental insurance. Because again, you're going to have an instance, you don't know. You get insurance because you're worried about something happening to you. Concierge plan is good to control your cost.
Got it. Now, just like you would in a regular Medicare plan or a Medigap, on the supplement and the Part D, you should be going for an annual checkup, right?
Yes, you should.
And why?
Because it keeps the costs down of the plans overall on that, but it's good to know as far as your health conditions and that. What if something changes, like I said, your Part D, or you need some kind of medication? It's really good to go. And it's interesting you said that, because depending on what plan you have, some say it's an annual wellness,
right?
And others say it's a physical. So it depends.
Same concept.
Same concept, but they charge in one and they don't charge for the other.
Got it. Well, the bottom line is that if you're going on Medicare and you're entering into that next stage in life, let me tell you, if you thought you had to navigate your insurance company before, you're going to have a lot more work now going forward. And then also, when you get the work and you have the supplemental plan, you got to match what Medicare is paying, what the supplement's paying,
correct,
what applied to your deductible. The paperwork can be just outrageous in and of itself.
Correct.
And then let's not forget that many of the times they're sending these bills to seniors and they think, oh, it's $30, I'm just going to pay it.
Correct.
Where they didn't apply for the supplemental insurance. So there's a lot of paperwork. It's kind of scary. It's a frightening time for many seniors. So today, what I would urge everybody to do is, if this is the time of life that you're going to go on Medicare, or if you're a senior and you're entering into that next period of time where we're getting into that open enrollment, it's time to see Anna or someone like her, because navigating this is extraordinarily difficult.
It is. And there's so many penalties involved too, where people don't realize as well.
Yeah, and your eligibility also on the supplemental plans, if you have to go into a short-term rehab facility, there's so much information to know. And I know from personal experience with family members that are seniors, they're just frightened.
Correct.
And rather than be frightened, let's use this as an education tool. So we encourage everybody to either contact our office, we can get you information, get you to Anna, and we can work together to help you move forward in a positive way. So thanks for sharing this information today.
Thank you.